Recording in progress.
Hey, Shannon.
Hey, Eric, yes,
About ready to go?
we still have a few people that are trickling in.
Not a problem. We'll wait. Thank you.
Sure. Jay, I'm going to mute you. We can hear your background noise. Okay, I think we have everybody in that we were waiting on. So before we go to our Facebook Live, I just wanted to let you know that at the end of Eric's update, you can raise your hand and I can call on you if you do have any questions, and we can go that route. So please raise your hand and I will call on you and you may ask your question at that point in time. Also, I believe I gave everyone permission to record. If you are in need of a recording, please go ahead and try that. If you are having any issues, let me know so I can take care of it before we get going. Okay, I'm going to go on Facebook Live in just 1 second. Alrighty, Commissioner, go ahead and we're all set.
Thanks, Shannon. Good morning, everybody. Hopefully this will not take us very long, but I wanted to make sure that the community had an update on COVID. Unfortunately, we're talking about it again. I think we all thought that maybe this would be in our rearview mirror. But again, I think the main message is that we're going to have to live with COVID. I think we've seen the worst of it in the last several months to years. I think now we're going to have to, like I said, deal with it as it comes at us in these waves that we're experiencing right now. Several weeks ago, you know that increased cases were seen if you went on the East Coast, and now we're starting to see definitely increased cases in Ohio. If you look at the transmission rate, most of Ohio is red, and we are at a high category, as with several other counties in Ohio. And really what that is, if you remember the new CDC guidelines, we're over 200 cases per 100,000. And it appears that our admits in the hospitals are above 10 per 100,000. And that is kind of where we're at right now. What does that really mean for us? Well, there's some additional recommendations that CDC says, since we are in that high category. If you're inside, it's recommended that you should be wearing a mask. And I really urge those who are immunocompromised, who are very concerned about maybe a loved one at home, that you definitely do wear a mask inside. The idea here then too is make sure that you're up on vaccinations. But I think more importantly, from what I've been seeing in the community, seriously, if you're sick, stay at home. I've had a number of friends who've come down with COVID over the last week or two. And again, they're experiencing some slight illness. What they've reported to me is that, you know, they've gotten a very bad sore throat and a headache, but we're not really seeing those symptoms like we were seeing in months past and prior to that as well too. So it appears that maybe right now the symptoms are a little slight. But what I'm hearing too is that sore throat is like swallowing glass. So again, if you're sick, we really don't want to be spreading it to anybody else. We have the ability to test now that we didn't have many months ago. We have those home test kits. So please keep on top of your health. If you are sick, let's not spread it to somebody else. And again, let's contain this as much as we possibly can. But again, the good news is that I don't think that we're seeing, like we did in the past, those significant issues of symptoms and again, of those getting admitted to the hospitals. Again, they're relatively low. The numbers we're seeing on a daily basis, if you would, last week, a little bit over a week ago, excuse me, we were around 120, 125. A week prior to that, we were about 110. Currently, we're in the low 90s. So you kind of see how maybe this is ebbing and flowing. Let's hope that we're tailing off and again, seeing less cases. Again, wanted to make sure that the community heard of where we're at and maybe where we're going, hopefully. Again, we've seen that we've had a sharp increase in cases in other places and a little bit of fall off. Per 100,000 cases in Ohio for Lucas County, we're over 300 per 100,000. That's a 14-day average. So we definitely are seeing transmission and COVID issues inside the community. Again, I do urge everybody who is immunocompromised, who have health issues, to really pay attention to those recommendations. And for those of us who maybe aren't so ridden with health issues, we still need to take care of each other. So again, do what you need to do to make sure that you personally are taking responsibility to not spread COVID. And again, we've talked about those things a number of times. So with that in mind, again, I wanted to make sure that we presented this to the community. And please, any questions about COVID?
Sutton has a question. Go ahead, Sutton, and please ask your question.
Hi, thank you so much.
Sure.
I was wondering, with it being summer, what are you all expecting with the trends with students or kids now out of school being out and enjoying the summer? What are you guys expecting to see?
If you originally remember several years ago, we felt that the summertime was going to allow us to have definitely decreased cases. I think what we've seen in the past couple of years is that doesn't really hold true. I would hope, again, as we come out of school, as we spend more time outdoors, that we definitely see a decrease in cases. But again, what we've seen in the last couple of years, that doesn't hold quite true. We've seen spikes in the summer or towards the end of summer. I would, again, I would urge everybody to make sure that you live your lives, even with COVID out there. Just make sure you're taking adequate precautions to keep yourself safe and healthy, as well as those around you.
Caylee, please ask your question.
Hi, Commissioner. Thanks for doing this.
Sure.
My first question, when we've previously seen Lucas County or Northwest Ohio move to the red, high incidence for the CDC, we used to be kind of worried or nervous. Is this anything that anyone really has to be too worried about, since we've been living with it for so long and we've made it through all of these waves since COVID first hit?
Caylee, that's a great point and a great observation. I think that's exactly where we're at. Again, we need to make the community aware of what's happening with the disease, but also then too make sure that we all understand we've gone through several of these waves. And again, it was hard on our healthcare professionals for some of them, for some of those waves. We really inundated those hospitals. Hopefully, we're not going to see that. But again, I think you're right, Caylee, that we've been through a couple of these. We need to make sure that we understand that we're probably going to go through several more in the future. Again, as these do pop up, we just got to take the precautions that we need to make sure that we limit that spread as much as possible. Again, we can't say 100% that what we see right now relative to the less severe symptoms that we're presenting. Again, the headache, the sore throat, maybe the body aches, unlike what we really saw prior to, where we had some really significant symptoms. Let's hope that what we're seeing right now holds true. And if that's the case, again, it kind of is like we're dealing with the flu season or cold season, with that understanding that COVID does act a little bit differently.
Are there any other questions from our media friends? Well, at this time, if there are no other questions, we'd like to thank you for joining in. Well, we've provided an update for Lucas County and the COVID recommendations. Thank you.
Thank you, everybody.